Your body kind of recognizes it as food, kind of doesn't. It doesn't really know what to do with it. So this is why there's huge rises in cancers, organ dysfunction, kidney disease. Have you seen the movie Super Size Me? Okay, good. We ordered some for our lending library, and please take advantage of this. But what happened is, this guy lived a kid's dream. How'd you like to eat McDonald's breakfast, lunch, and dinner? I mean, it kind of sounds good, on the surface. Well, this guy, 182-pound guy, 6 foot tall. What's interesting, at the start of it, he got 3 physicals from 3 different doctors. And he had high blood pressure at 2 of the doctors and normal blood pressure at the 3rd. So that should kind of tell you something there. Okay. It's not really an accurate gauge. It's a rough guide. Well, they all said, don't worry about it. Your kidneys can handle the extra salt. Your liver can handle it. It's not poisonous. You'll be fine. Within 2 weeks, he had kidney damage. Within 4 weeks, he had cirrhosis of the liver. So this is a big deal. So just think about that supersize me. Within 2 weeks, kidney damage, 4 weeks, liver damage. That's because every time he's eating something which has the trans fatty acids, which has the synthetic fats, the hydrolyzed vegetable oils, the excess processed sugars, the things that your body is not designed to process, but it looks like food. It gets inside of your intestinal tract and causes damage. Now, these are the blood pollutants. These are the things that are never in this lifetime. And it's tough because we have healthcare professionals that are recommending some of these products. There's some people out there with diabetes, and the diabetes doctor is recommending synthetic sugars. That is so beyond stupid, it's ridiculous. So toxic food. And this goes into have you heard, what's worse, the pink stuff or the blue stuff? The aspartame or the Splenda? The chlorinated sugar or the refined ant poison, which is aspartame? So you got to look at it. If it's made by man and it has a long shelf life, that means bacteria isn't eating it. If bacteria doesn't eat it and it doesn't rot, we don't want to put it in our system. Does that make sense? That's like a good rule of thumb. Okay. You want stuff that rots quickly so you can have it going in there quick. Medications. Now, this isn't some medications. This is all medications. Medications are tested first in animals, then they're tested on poor college students, and they're only tested one at a time, and they're tested for a maximum of about 8 to 12 weeks. There's no studies that compare the diuretic with the aspirin, with the antidepressant, with the antacid for year after year after year after year. Okay, so all medications you have to rethink, and we will do a medication drug search for you and find the interactions and help you get off of them as quickly as possible. Vaccinations. Now this is interesting because, remember, it's in your bloodstream. What the contents of the vaccines are is they have to use a preservative, and it's impossible to grow a virus by itself. It's absolutely impossible. You need certain tissue in order to grow a virus. So when you see a vaccine, you're injecting infected tissue inside of a bloodstream. Now, does that have an effect on the immune system? Yeah. What are the effects? We're not quite sure. No one's ever seen an experimental population like this where children are getting 74 vaccines. So it's kind of a new thing. I mean, you can look back at the history, at the cancer rates of kids before 1960 and the diabetes rates and the chronic disease rates. It was almost non-existent, and it's skyrocketing now. So we can kind of look back, step back. It's tough to see our population get destroyed, but it's kind of interesting that we weren't dying of measles and chicken pox and all this other stuff in the 60s, but we are getting huge rises in cancer and chronic diseases. So this we need to rethink. Environmental and skin creams. When we talk about massive amounts of toxic creams, when we talk about skin health, anything you put on your skin is going to get in your bloodstream. So if it says for topical use only, guess what? It goes in the trash. Okay, topical use only, that's ridiculous. Anything you put on your skin goes directly in your bloodstream. Now this is interesting. Toxic thoughts. Can thoughts change your blood?
Yes.
Any science behind that?
Yes.
Would you like to see it?
Yeah.
I know. I thought it was kind of cool too. Now, studying water. I've got 4 books on water. How stupid do you have to be to keep reading about water? What's water? H2O, right? Okay, you got 2 hydrogens, 1 oxygen. Okay, that shouldn't be that hard to think of a molecule like this. Well, it is. What's interesting is, now remember, your plasma is 90% water. 90% water. Can thought actually change water? Well, there's this Japanese scientist called Dr. Emoto. Now what he did, he took water from the same exact source. And he didn't do it just one time. He's done several studies on this. And he taped thoughts on the outside of a bottle. And then did frozen crystal formation. And had 100 people arrange these slides. And this is, the chi of love. He just wrote love on the jar. This is, you make me sick. And this one is thank you. So positive thoughts can affect the water. What's interesting, I just read a study that he did where they had 2,000 people in Japan focus their positive intentions on a jar of water in San Jose, California. So that's about 10,000 miles. Okay. And the jars were taken from the same source. What they didn't tell anybody in the Japanese side is that there was a control in another area of California. And they checked the crystal formation, and again, they found a radical difference. So thought travels further than 10,000 miles, or that intention. Very interesting study. And their error rate is so low, it's absolutely reproducible. Interesting, isn't it? I know, I thought so too. And it also goes along. So now here, the power of green. What I want to do, since we're explaining, you ready? Good. Since we're explaining on good stuff inside of the body, you got to know the difference between soluble and insoluble fibers. Now this has both. Break out the bananas too.
Okay.
Thank you. Soluble fibers get inside of the arteries and actually clean them out. And now what's tough is my brother-in-law, he's a great guy, wonderful guy, loves my sister, he's like a gift from God. But he doesn't listen about health. So he's always eating cheeseburgers, fast food, not good stuff. He ended up having chest pain, and of course they looked at him and they says, oh, your arteries are starting to clog. So what do you think he did? John, I miss you, you're right, I'm going to turn over a new leaf, I want to get my arteries clean, I'm going to start eating healthy. Or do you think they put a stent in him? God, you guys are so smart, you're right. He didn't listen to me at all. Okay, the problem with the stent is you've got an artery and you've got this little metal cage that pokes up the artery. Is that going to irritate the lining of the artery?
Yeah.
Hugely. And that's why now then they medicated the stents that pop open arteries, and that causes increased blood clot formation. And all you got to do is just Google stents and you'll be part of a dozen or so lawsuits, okay, that are out there. Which is kind of frustrating because I love him and he loves my sister, so I want him around a long time. So this is what he can do to decrease clotting formation around that stent, increase the soluble fiber inside of his arteries, and clean out any other arteries that may be starting to be clogged. Would that make sense? Okay, so we're going to use some exotic stuff here. First off, we're going to use a coconut. Now this coconut is loaded with saturated fats, which are healthy fats. This means that your body is going to be repairing itself. So to open a coconut, what you do, and this is called a young coconut, you only need to put a knife on it and hit it. Now, we're going to do this just 4 little hits. Okay? So it's super, super easy. No, it's actually, it's pretty easy to do. Anybody can do it. It just looks nasty when I'm doing it because my arm's big. And now here, now that's coconut, and this, you can actually stick the spoon inside and scoop it out. And this is the rich saturated fats inside of the coconut itself. And if you could do that, and she's going to scoop it out and put it in there.